Okay, as I said, please feel free ask questions. If you don't understand or if you cannot see my slides, my screen, or cannot hear well, please share with me, okay? We are going to go forward together. Okay, now these are the profession of the clinical laboratory science. As you see, we are working in a team. It doesn't matter what are you going to be, okay? Either physician or pharmacist or, but you have to have a clinical laboratory skills. It really helps you to get diagnosis, differential diagnosis, or to treat your patients. And as I said, we are working as a team, doctors and director of the laboratory, technicians, and lab managers, okay? And team working is most important skills that we need to earn during our education. Okay, now what we are going to do in the clinical laboratory, the clinical laboratory testing plays a crucial role in the detection, diagnosis, and treatment of disease. Okay, the result that we provide to the physician help them to diagnose or to treat the diseases, okay, or to follow the efficiency of the treatments. And the laboratory professionals, they usually collect, analyze, and examine the specimens. And also they have to communicate results to the physicians and other healthcare professionals. As you see, communication is important and hand-on skills also really important. Okay, now let's talk about the history of our profession a little bit. I am going to summarize the slides. Some of the slides I am going to skip, okay? But you have to review them, okay? You are responsible for all the slides that I provided on the Brightspace, okay? As you see, the first organization about our professional is founded in 1928, which is the American Society of Clinical Pathology. And then in 1933, the American Society of Clinical Laboratory Technicians, and then clinical laboratory is and now is known as American Society of Clinical Laboratory Science. And when it's come to 1960s, as you see, the individual professional recognition is generalist medical technologist or a medical laboratory technicians, which was developed as 2 years associate degree programs. And then they also categorize into different specialty, such as chemistry, microbiology, hematology, and blood banking. Okay, now when it comes nowadays, as you see, the generalists become referred to as medical laboratory scientists, and the similar technician level designation continue to be designated as medical laboratory technicians, okay, MLS and MLT, okay, and the appropriate professional credentialing is MLS for medical laboratory scientists, and MLT for medical laboratory technicians, and the institutions is the same, American Society of Clinical Pathology. Okay, when it's come in 2012, a post-bachelor degree, which is doctorate in clinical chemistry, was approved in the US, and the National Accrediting Agency for Clinical Laboratory Science, which we call NICOLAS, categorized the responsibility of the doctorate in the clinical chemistry, in the clinical laboratory science, into 5 areas. These are patient care management, education, research, application, healthcare policy development, healthcare policy and development, and healthcare service and delivery and access. Okay, as a summary, the clinical laboratory functions. The laboratories serve to educate the physician and other healthcare providers, so that the information that we provided to the physicians, it should be well known, should be understood by the physicians and other healthcare professionals in order to interpret the test result correctly. Okay? And therefore, we need to know that we all are on the same page. As a clinical laboratory scientists, physicians, and other healthcare professional, we need to know the clinical laboratory science well, okay? The test that we provided, the information in the test report should be understood well by the team members. Okay, now we know that laboratory medicine in the healthcare is really important. Estimated that about 70% of all diagnoses rely to some extent to the laboratory results. And without the lab results, the physicians are not able to get a correct diagnosis or to follow their treatments. We know many diagnostic protocols require laboratory findings, and it varies by specialties. Let's say a lab plays a larger role in the internal medicine or in the pediatrics diagnostics than the psychiatry. It depends on the specialty. Okay, we know that lab plays a big role in the internal medicine, in the pediatrics, or in the nephrology, or in the cardiology than the other specialties such as psychiatry or physical therapy and so on. Okay, now when the test ordered, the clinical laboratory should assume a role of the leadership and education in assisting the physicians. Okay, as I said, we have to educate the other team members in order to help the patients to get a correct diagnosis and to follow our treatments. And also the clinical laboratory should improve the clinical decision-making process for the physicians in order to provide a correct test results, the test result that help the physician to make a diagnosis. And we also need to consider the cost involved when we select the test. Okay, we need to think also about its cost. Okay, when it comes to staffing in the clinical laboratory, as I said, we are working as a team, and in these teams, these teams include pathologists or PhD as a director, and clinical laboratory personnel such as laboratory supervisor or manager, or a business manager may handle administrative details, or technologists, technicians, and specialists. These all are working as a team in order to get a lab results and provide them to the physicians and other healthcare professionals. Okay, now we need to know the duties of the technologists, technicians, and specialists well. Since this is a core issues of these lectures, okay, the responsibilities of the MLS or MLT vary, but they may be include performing of the laboratory tests, supervising other staff, teaching, and research. Okay, they also have to be able to correlate and interpret the data that we are obtained, and they collect blood specimens and process them for analyzing them later. Okay, as a summary, the staffing in the clinical laboratory, they performing the laboratory tests, and they supervising other staff, teaching, also they may do some kind of research, okay? And they gaining of in-depth knowledge about principle of the methodology and instrumentation, and then therefore they are able to correlate and interpret data. Okay, also they collecting blood specimens and process them. Okay, now, as I said, I will provide questions in my lectures. Okay, you will see many questions. Now it is time to send your responses to these questions. Okay. Okay, the more you will faster, okay, the more we will finish the class earlier. Okay, don't be afraid, send your answers. Now it is your time. If you paid attention, it shouldn't be hard to have a correct answers. Okay, I have also in the chat box. Now let's see your responses. Okay, all above correct answer. Okay, detection of disease, diagnosis, and treatments all are main function of the clinical laboratory. Okay, now, okay, let's see. Okay, which of the following is the not primary job of the laboratory professional? Order the test, collecting of specimen, analyzing of specimen, communicate result to the physician, which is not a primary job of the laboratory physicians. Okay, these questions is also easier, but you may have some technical issues with these questions. I'm going to show you. Okay, order of the test is not a job of the laboratory professionals. The physicians they order the test, okay? But we also need to educate them in order to order a correct test, right? Now let's see what I have for you else. Now this is, okay, which of the following is not the duty of the technologists or technicians or specialists? Okay? Hiring the staff, performing the laboratory assays, supervising other staff, teaching or research. Now go ahead and send your answer. Go ahead in chat box. Okay. Okay, now see your answers. Hiring the staff is not our duty. Correct answer. Okay, you see the questions, how look like my questions. Okay, it is not hard to get a higher score. Okay, now I'm going to ask you some question later. Okay, pay attention now. Okay, the clinical laboratory improvement amendments, which we now we call as CLIA, okay, CLIA of 1988. Okay, the goals of the CLIA is to ensure high quality of lab results, okay? And it's clear requirements for personnel defined, because in order to get a high quality of lab result, you have to have qualified lab personnel, okay? And therefore, CLIA standardize the lab personnel, the personnel which are working in the lab, and therefore it defines the responsibility of the lab personnel, educational requirements, training, and experience of employees performing tasks of the moderate of highly complexity. Okay, now I am going to show you how we classify the lab tests. However, as you see, there are no clear regulation for testing personnel who work at sites performing only wave tests or provided performed microscopy testing. We are going to classify the lab test in a few minutes as a wave test and non-wave test. And requirements are more stringent for those performing tests of the highly complex category. And therefore, there are a standards both for personal experiences, personal responsibilities, who are working with a lab test of the high complex category. Okay, now the level of the general laboratory testing include waiver tests, moderately complex tests, and highly complex tests. Or you can classify all the tests, waiver tests and non-waiver tests. And non-waiver test is categorized into moderately complex tests and highly complex tests. The criteria for classifications uh, include risk of harm to the patient. Okay, the more you have high risk of harm, that means these will be complex tests. Okay, risk of an erroneous result, type of testing method used, degree of independent judgments and interpretation needed. There are some tests you have to make a decision, okay? You have to interpret it, okay? But some tests, they don't need to, they don't need interpretation, okay? If you are measuring the blood glucose, okay, you prepare sample and put on the instruments and get the results. Okay, you don't need to have a decision making or interpretation for that. However, for some tests, we need to be able to make a decision before we release the test result. Okay. Okay, waiver tests, okay, as I said, we categorize the lab tests, waived and non-waived, okay. Non-waived tests may be moderate, uh, complex, or highly complex tests, but waived tests, as you see, they cleared by the U.S. Food and Drug Administration for home use, okay, and these tests use a simple methodology, unlikely to cause erroneous result, and possess no reasonable risk of harm to the patient if you perform incorrectly. Uh, an example of the waiver test can be dipstick urine analysis, as you see here, or blood glucose. There are several waiver tests that you can use um, at the site of the patients, or uh, or you can use home. Okay, provided performance microscopy, a kind of moderate complexity test, okay, uh, as the name implies, it is some tested that we examine under microscope, okay, must be personally performed by the practitioner and must be categorized as moderately complex test, and the primary instrument for performing this test is microscope, but not all microscopes, because there are electron microscope, confocal microscope, or uh, a simple um, microscope such as bright fields or phase contrast microscope. This provided performed microscopy is only about bright fields and phase contrast microscopy. Okay, and the spacement is liable. Control material are not available in such lab tests. Okay, now what are the departments of the labs? Okay, it's the departmentalization of the labs based on the size of the labs and the number of the tests done in the labs. Okay, the more the size is big, or the more the number of the tests is higher, then you will categorize the labs in many different departments, such as clinical chemistry, hematology, microbiology, or CBS, as you see here, cytogenetic, toxicology, flow cytometry, and molecular diagnostics. And the trend is to have a more open design, or a core laboratory, as we watch in the videos, where hematology, urinalysis, hemostasis, coagulation, and clinical chemistry share workspace. As we watch in the videos, all these departments, they are working almost on the same in the same space. Okay, they sharing the workspace. That means the laboratory professional, they need to cross training, okay, in a core laboratory models. Okay, you may be a specialist in the hematology, but also you need to know some information about clinical chemistry, or coagulation, or microbiology. If needed, you may replace some employer in the microbiology or in the clinical chemistry. Okay, now it is your turn now. Instead of giving a break, I put a questions, okay, between my slides. Okay, I try to make more enjoyable it, but you have to participate. Okay, you have to send answers to these questions. Okay, it doesn't matter whether it's correct or wrong. Okay. Okay, go ahead and send your answers. Okay, in chat box. It will be great if you use your smartphone and send answer to these questions. As I said, I am not able to differentiate, to distinguish who sent these questions. Okay, and therefore you okay. Interrupt. What does means? Tempting recognition. Okay, let's see if I can. Okay, are you there? Can you see my slides?
We can see it. My answers just never went through.
Okay, okay. Now let's see. Okay, something's weird.
Yeah, I sent my answer. I guess it didn't go through.
Okay, okay, okay. Let's skip this question. Okay, what is the definition of weighted laboratory test? Okay, the correct answer is the B. Okay, a test that can be performed by it should be. Let's see, what is the correct answer? Is D, right? The test that is moderately complex. Let's see, one of the is clear. Waiver test. Okay, waiver test. One of tests is cleared by the FDA for home use. Okay, the correct answer is A, right? Okay, okay. The correct answer is A. Okay, it doesn't matter. Send your response. I don't care whether is correct or not. Okay, no. Okay, next one. Okay, clear personnel requirements specify which factor or factors: experience, education, training, all above, or none above. Okay, let's see. All above is the correct answer. Good. No. Okay. Now go ahead. Since I have some other slides and some other questions. As I said, the departmentalization of the lab based on the size and the number of the tests, okay? And a working clinical laboratory is traditionally organized into several major scientific disciplines such as blood banking, clinical chemistry, hematology, microbiology, immunology, flow cytometry, and urine analysis. But as I said, it depends on the size of the lab, the size of the facility, and the number of the tests. Okay, the core lab configuration combines routine hematology, homeostasis, and blood coagulation and clinical chemistry together, as we saw in the YouTube videos. Okay, as you see, many medium to large site laboratory have developed a central testing area with a cluster of instruments. They bring all instruments they need in the same space and working together as a team and sharing the space with other departments, which is more efficient, okay, for both for the laboratory and for the patients, okay. Okay, the video that we already watched, but I suggest you to watch them later again, the whole videos. Okay, now the healthcare organization, which is also related to the clinical laboratory. We know modern healthcare organizations have many different configuration depending of the geographic region or market or mix of patients, overall size and affiliations, okay? If you have let's say, a hospital only about a cardiology or cardiovascular surgery, the the organization will totally different than a general hospitals. And the size of the healthcare organization range from a very large tertiary care level teaching hospitals to community hospitals or freestanding specialty clinics or phlebotomy driving stations. Okay, I have to now see laser pointer again. Okay. The other high level position in the healthcare, I may come here now. I skip one of them. As you see, the common organizational structure for hospitals include the chief executive officer, okay, and the board of the trustee who set the policy and guide the organization, and the chief executive officer who apply these policies, okay, implement these policies in the daily work. Okay, and other high-level position in the hospitals, as you see, the chief financial officer, chief information officer, technology officer, and also vice presidents. And the vice presidents of nursing, clinical service, general service, and human resources. The vice president of clinical service oversee the manager of the clinical laboratories, which is associated our lectures. Okay, now the primary accrediting organization, okay, we need a organization which accredit our labs, okay, which also standardize the quality of the labs. As you see, there are three main institutions related to the accrediting of the labs. These are Commission of Office Laboratory Accreditation, College of American Pathologists, and the Joint Commission. These three organizations are about a accreditation of clinical laboratories. Okay, there are other organizations related to the blood banking, or as you see, American Society of Histocompatibility and Immunogenetics, or American Osteopathic Association. These are other organizations about primary accrediting organization. Okay, there are external government laboratory accreditation and regulations. In addition to the CLIA, as I said, CLIA is about establishing of standards for clinical laboratory, but there are, in addition to the CLIA, there are state and federal regulation that regulate the chemical waste disposal, use of hazard chemicals, or issues of laboratory safeties. And these also, we also need to follow this regulation in addition to the CLIA. Okay, we also classify the laboratory tests as an alternate sites of the testing, central laboratory testing, which are doing in the core laboratory, point of care testing that is at the time and place of the patient care, just close to the patient beds, and reference laboratory. There are advanced laboratory. They are advanced than the core laboratory, okay, for some rare tests, some advanced tests, and physician officer laboratory, which they perform simple tests, okay. Mostly waiver tests are done in the physician officer laboratories. Okay, when it comes to medical legal issues, there are a few things that we need to know. The first one is informed consent. Informed consent means that the patient is aware of, understands, and agree to the nature of the testing to be done, and what will be done with the result reported, which that means it's signed a consent. That means the patient is aware of the procedure that we are doing. Confidentiality is other important medical legal issues, okay, and it's standardized and is followed by HIPAA, which is Health Insurance Portability and Accountability Acts, okay. Any results obtained for specimens from patients and any information about the patients must be kept strictly confidential. Okay, this is our responsibility to be assured that we store the information about the patients in a safe environment. Okay, other medical legal issues is chain of the custody. Okay, what does means? Okay, when specimens are involved in possible medical legal situation, okay, certain specimen handling policies are required. Okay, what does means? Medical legal situation. Okay, you have a specimen of patient who involved in a crime, okay, or who involved in a car accidents, okay, and for such patients, for evidence to be admissible, each step of the analysis, beginning with the moment of the specimens, is collected and transported to the laboratory to the analysis itself, and reporting of the result must be documented. Okay, in the case of medical legal situation, all steps of the lab procedure from the beginning, from the collecting of the specimens to the sharing of the lab report must be documented. Okay, which is not maintaining the chain of the custody. Okay, medical ethics, other issues as a healthcare professional, it doesn't matter. You can be either physician, pharmacist, or lab technicians, but you have to know the medical ethics, okay? The personal ethics are based on values, ideals, customs that are held in a high regard by an individual or group of the people, which created by our society. Okay, we have to care of them. Okay, now association American Society of Clinical Laboratory Science is an entity, one of the most important institution, and also a professional code for ethics, which states that all laboratory professionals have a responsibility for proper conduct toward to the patient, colleagues, and the profession and society. Okay, now, again, it is your turn to send your responses to these questions. We're almost done. These are the last questions. Okay. Okay, I have some questions, some answers in chat box. Thank you, guys. Now let's see. Okay. Okay, C and D is correct answer. Which certifying agency or agencies are about laboratory accreditation? Okay, two of them. Okay, these are College of American Pathologists, okay, the Joint of Commission, okay. Commission, it should be also A, also included, okay. I mean, it's the A, D, A, C, and D, okay. Three agencies about accreditation of the clinical laboratory. Commission of on office laboratory accreditation, okay, and College of American Pathologists, and the Joint Commission, as I showed you in the previous slides, okay. Now I am going to clear them. Okay, next one. Which factors that inform informed constant upon the patient's hospital admissions includes? An agreement to the nature of the testing to be done, an agreement to what will be done with laboratory test results, constant to many routine procedures that may be performed. Okay, let's see now your response, all of above. The correct answer is all above. Okay, correct. Okay, that's good. Good job. Now, okay, one more. Which federal legislation requires strict confidentiality of the patient's results? The privacy of the patients. Okay, this is really important question. We have to know, as a healthcare professional, as a healthcare provider, okay, let's see, okay, HIPAA. HIPAA is the correct answer. Good. Okay, now I'm going to, okay, what is the definition of chain of the custody? Which was the last slide. The definition of the chain of custody. The physical transport of the specimen needed for legal reason, the escorting of patients who are prison inmates, the process of documenting each step of specimen analysis and reporting of the specimen result, and the documentation of quality control when reporting a patient laboratory result. Okay, pay attention. It's a tricky question. Okay, I have also in the chat box. Good. Now let's see your responses. Okay, the correct answer is, okay, A and B also related to the chain of the custody. However, okay, since we are talking about the clinical laboratory science, okay, the process that related to our topics, okay, the process of documenting each step of the specimen analysis and reporting of the specimen's result, okay? As I said, collecting of the specimens, transporting of them, analyzing and reporting. Each step should be documented by the laboratory professional, okay? The correct answer is C, okay? No. Okay. This should be last question. Which statements best describe ethics? Ethics are law that people live by. Ethics are a set of moral principles. Ethics are voted on by the people. Ethics are required in every profession. Okay, the definition of the medical ethics or ethics. Okay, let's see now. Okay, ethics are a set of moral principles is the correct answer. Good. Okay, that's all for today. Now I am going to stop share.